Welcome to Nurse Navigator, 2025, Respiratory Disorders, Multiple Choice Questions and Answers and Description. Smokers have shorter breath due to atherosclerosis, emphysema, hypertension, cough. The answer is emphysema. Emphysema is a chronic disorder in which alveolar walls are damaged due to which respiratory surface is decreased. One of the major causes of this is cigarette smoking. The person experiences shorter breaths because of the reduced respiratory surface. The alveolar walls get damaged and over time they rupture. Important points. Atherosclerosis, coronary artery disease, often referred to as atherosclerosis, affects the vessels that supply blood to the heart muscle. It is caused by deposits of calcium, fat, cholesterol and fibrous tissues, which makes the lumen of arteries narrower. Hypertension. Hypertension is the term for blood pressure that is higher than normal, 120/80ths. In this measurement 120 mm Hg is the systolic, or pumping, pressure and 80 mm Hg is the diastolic, or resting, pressure. If repeated checks of blood pressure of an individual are 140/90ths, 140/90, or higher, it shows hypertension. Cough. A cough is a forceful expulsion of air from the lungs that helps to clear secretions, foreign bodies, and irritants from the airway. Therefore smokers have shorter breath due to emphysema. Asthma, a respiratory disease, is caused due to infection of trachea, infection of lungs, bleeding into pleural cavity, spasm in bronchial muscles. The answer is spasm in bronchial muscles. Concept. Asthma is a chronic respiratory disease. It is caused by the narrowing of the bronchi and bronchioles that serve as air passages to the alveoli of the lung for the air that we inhale. The bronchioles are lined by circular smooth muscles, the contraction and relaxation of which control the diameter of the bronchial lumen. Any factor that irritates the bronchi or lungs triggers the bronchioles. As a result, the smooth muscles contract and lead to a narrowing of the bronchioles. Repeated contractions of the bronchial muscles causes a spasm. This leads to excessive mucus production and the airways are blocked. Air is unable to reach the alveoli of the lungs and the person has extreme difficulty in breathing. Additional information. Asthma is caused due to a variety of genetic as well as environmental factors that include genes like the ORMDL3 is associated with asthma in children while HLA-DQ is related to the onset of asthma in adults. The presence of excessive suspended particulate matter, unburnt fuels, as well as allergens and toxins. Viruses like respiratory syncytial virus, adenovirus, coronavirus, bocavirus, and metapneumovirus contribute to the development of lung infections and asthma. An asthma attack is characterized by the following: bronchial muscle spasm. The repeated contractions of the smooth muscles lining the bronchioles causes muscle spasm that constrict the lumen of the bronchioles and narrow the air pathways. Increased mucus production. The narrowing of the bronchioles expedites the production of mucus that further jams the airways, making it difficult to breathe. Coughing and wheezing. The difficulty in breathing and the clogging of airways leads to congestion in the throat that is characterized by intense coughing and whistling noises, wheezing. Inflammation. The airways get inflamed and swollen, which narrows the diameter of the airways, and increased irritation of the bronchioles causes greater mucus production. Confusion points. Asthma is not to be confused with bronchitis. Bronchitis refers to the inflammation of the mucous membrane lining the bronchial tubes. The mucus-secreting cells have a role in trapping any foreign particles that may trigger or harm the respiratory tracts. Inflammation of this lining causes increased mucus production and coughing. Normal lung and asthmatic lung. Thanks for watching. Like, share, subscribe.